Welcome back to Physio Vibes. In this video we are going to look at
dances, fracture and physiotherapy management.
Before we start, hit the subscribe button for more videos. Press the bell icon and never miss another update.
Dances, fracture and physiotherapy management. In 1902, Sir Robert Jones described a foot fracture he suffered while dancing. An avulsion fracture on the fifth metatarsal bone is called a dances fracture. A dances fracture occurs when the foot is forcefully inverted and plantar flexed, while the peroneus brevis muscle forcefully contracts to stabilize the foot. This mechanism of traction from the peroneus brevis tendon or lateral cord of the plantar ponderosis strongly pulls on its attachment site on the fifth metatarsal. Dances fracture. This type of injury needs to be differentiated from a Jones fracture. Jones fracture occurs where the base meets the shaft of the fifth metatarsal. A dances fracture is an avulsion of the tip of the fifth metatarsal base. Mechanism of injury. A dances fracture occurs when the foot is forcefully inverted and plantar flexed, while the peroneus brevis muscle forcefully contracts to stabilize the foot. This mechanism of traction from the peroneus brevis tendon or lateral cord of the plantar ponderosis strongly pulls on its attachment site on the fifth metatarsal. During an avulsion injury, a small fragment of bone at the base of the fifth metatarsal is pulled off by a strong ligament that is attached to this part of the bone. Clinical features. Patients will give a history of a twisting injury to their ankle and foot inversion plantar flexion injury, similar to what occurs with an ankle or foot sprain. There will be marked tenderness at the base of fifth metatarsal. On exam, if the patient can still move their foot to the outside version of the foot. This is done by placing the foot in an inverted position and asking them to maintain that position against some resistance. Doing this usually creates some discomfort for the patient. However, they usually are able to perform the action. Complications of dances fracture. A dances fracture has a tendency to heal poorly because of poor blood supply and its tendency not to fuse back to the fifth metatarsal, also called a non-union. Early diagnosis and evaluation allows for proper diagnosis and treatment of these fifth metatarsal fractures. Additional injuries associated with the foot crush injuries, bedroom fractures, chip fractures. Mechanisms of injury of foot and ankle fractures happen with many types of inversion sprains because of the body weight's force across the foot. Diagnosis. X-ray of the foot will reveal an avulsion, pulling off, fracture of the base of the fifth metatarsal. There will be more gapping at the fracture site, plantarly on the bottom of the foot and on the outside of the bone lateral side, compared to the inside of the bone medial side. Treatment. If the patient has the ability to actively move the foot outwards eversion, the injury will heal with non-operative treatment. Treatment involves relative rest and time to allow the fracture to heal. 3-6 weeks of relative immobilization in a cast boot. This may include a period of non-weight bearing for comfort. Then walking as symptoms permit in the boot. After 4 to 8 weeks, walking in a stiff-soled shoe is permitted. For most patients, 75% of the recovery will occur in the first 10 weeks, but a full recovery often takes 6 to 12 months. Surgery is usually not required except if the fracture is significantly displaced, or the fracture fails to heal non-union. Physiotherapy measures for Dance's fracture. Rest, ice, compression and elevation are given until the swelling is stabilized. Initially no weight bearing on the affected limb as the bones continue to calcify and heal properly. The therapist could perform soft tissue massage, joint mobilizations, electrotherapy, hydrotherapy and later on exercises to increase strength, flexibility and balance. The patient should be encouraged to perform active mobilizations, plantar flexion, dorsal flexion, inversion and diversion of the foot ankle. Depends on the severity of fracture. Gradually stretching and strengthening exercises increase. Weight-bearing exercises are given. The stability and proprioception in the foot can be trained with the balance board, for example the wobble board, Boju ball, Arex pad, sisal pillows. Post-operative physiotherapy measures. Patient will be walking with crutches non-weight bearing until most of the swelling resolves. Patient may be in a removable boot after surgery for a week or 2 at the direction of the physician. Limit unnecessary walking or standing for the first week to control swelling and pain. Ice ankle/foot 3-5 times 15 minutes each time per day to control swelling and inflammation. Elevate leg above the heart as much as possible to control swelling and inflammation. No impact or cutting exercises/activities for 6 weeks post-op. And then following rehabilitation protocol is done.
Thanks for watching. Don't forget like, share and subscribe.